Hey everyone, my name is Rachel. I'm a PA, which stands for Physician Assistant. And I just wanted to start a little series where I answer some questions that I commonly get from patients, from friends, from family. And this is not official medical advice to anybody. Definitely seek out your healthcare provider for that. But you know, a lot of us have questions and you don't have a medical friend to ask, so I'll be your online question and answer. And again, anything I say, you know what, check it up with your healthcare provider. And because there's lots of different opinions on matters, and medicine is an art, not a science. And what that means is there's more than one way to practice. So first question we're going to talk about is one that I get often from men, and it is, should I get a PSA drawn? A PSA is a blood test. It's specific to the prostate, and this test has been around for years. And when it first came out, people got pretty excited and thought, hey, this is a great tool to screen for prostate cancer. And over the years, we have learned that it's not a perfect test. And so the conversation I have with my patients is, you can get a PSA, but I want you to know that it's not a perfect test. And what that means is you can draw the PSA and the level may come back elevated. That does not mean that you have prostate cancer. It can also come back normal, and that does not guarantee that you do not have prostate cancer. So you have to take it with a grain of salt. And you also have to realize that if you do have an elevated PSA, that is going to put you into a process where you will be getting an ultrasound, you'll be getting several biopsies taken from your prostate, and that can be a stressful process and procedure to go through, especially if it turns out it was elevated for a reason other than cancer. If you've had a recent prostate exam, that can cause the number to go up. And also if you have a condition called BPH, which is benign prostatic hypertrophy, where the prostate gets enlarged, that tends to happen over time. That can have it increase as well a little bit. So, you know, we use the PSA, we definitely use it as a screening tool, but patients need to realize it's not an end-all be-all. And if it does come back elevated, you're going to go down a road that may or may not find cancer. And if it does, a lot of prostate cancers are very slow growing, and the treatment is worse than having the cancer itself. So this is a really good discussion to have with your healthcare provider based on your age, your family history, your ethnicity, may determine whether you should or shouldn't, or when you should start doing this test. Most men, if you're going to do it, should be between the age of 50 and 70. You wouldn't necessarily do it much before that unless you have a family history, or if you are a black man, you may want to start at 40. So lots of information and conversation goes into deciding whether to have the PSA drawn. Some men ask about a prostate exam. When you're doing an exam of the prostate, it does not allow us to feel the entire prostate. So we could feel the prostate, it feels normal from what we can feel, but that doesn't guarantee that you don't have a cancer in there, although it's not as likely. The prostate exam will tell us if it's enlarged, or if you have a nodule. That would be concerning if one side was bigger than the other, or we felt something firm on the prostate. So it's a good piece of information to have, but again, it doesn't guarantee that you don't or that you do. So that's the fun part about medicine, is putting all these pieces of information together, talking to you about your symptoms that you may or may not be having, and making a decision from there. So that's our first question for today. Second question is, should I take a vitamin B12 injection or a B12 supplement of some sort? Vitamin B12 is something that our bodies do not make on our own, but it's very critical to our health. Vitamin B12 comes from animal products, so if you are a vegan, then you will not be getting B12 in your diet, and you will definitely need a supplement. and there are lab tests to check to see if you're deficient and to tell us how much B12 you might need in your diet or if you need a shot. Also, some people have a rare type of anemia called pernicious anemia where they just do not absorb vitamin B12, and those people will need a definite boost in their B12, usually by injection. So those people definitely need to consider it. If you have been really tired, down, depressed, brain fog, numbness, tingling, those are the most common symptoms I see in a B12 deficiency. It wouldn't hurt to ask to get a B12 level drawn just to see where you're at on that B12. The good news about vitamin B12 deficiency is when you correct it, those symptoms go away. So that's very encouraging for someone that's dealing with all that and they just think, what's wrong with me? Well, all we need to do is correct the B12 and then you'll be feeling much better. So that's our first round of Ask Rachel the PA. If you have questions, please comment below and I'll try to make a new video with answers, the best to my ability, to your questions. It doesn't have to be medical. It can be any question about overall mental health, physical health. Ask, and if I don't know the answer, then I'll just tell you or I won't answer it. So thanks, guys.